The Centers for Medicare and Medicaid Services just cut the Medicare Part D PDP standalone prescription drug plan subsidy that they implemented last year by a third. Let's talk about what this means and what you need to know as a Medicare beneficiary. My name is Christian Brindle. I run a company called Everything Senior Insurance, formerly known as Christian Brindle Insurance Services, and we specialize in helping folks all over the country, 46 states, with their Medicare health plans, and we charge nothing for it. There's no cost, there's no obligation for our services. What we do is just look through the options and help folks on Medicare supplement plans and Medicare Advantage plans find their best fit based on their needs and preferences. And going into this open enrollment period, there is some information you need to know if you're on a Medicare supplement plan and you have a standalone Part D prescription drug plan. So, starting January 1st, 2025, there was an aspect of the Inflation Reduction Act that took effect that changed all Medicare prescription drug plans and prescription drug coverage to require them to have a mandatory maximum out-of-pocket cap of $2,000. What this means is the plan has to cover your prescriptions at 100%. Anything after $2,000 is spent over the course of the calendar year. This is groundbreaking because never before had Medicare prescription drug coverages had to give you a maximum out-of-pocket cap. And the system that was in place previously was in place for 20 years, since 2005. Now, the obvious domino effect of this that anybody that was in the insurance industry was pointing out, myself included, was this was going to cause premiums and costs for prescription drug plans to spike exponentially, which we were expected to see going into open enrollment last year in 2024. But at the final hour, CMS stepped up and provided a subsidy to any Medicare insurance company that was providing standalone prescription drug plans of $15 on a monthly basis per member. What this means is they would pay $15 per member extra to the insurance company if they agreed to a few different terms. The first thing of those terms is they agreed that they cannot raise the premium more than $35 per month as a cap. They were limited of how much they could actually raise those premiums in a year-to-year basis, okay? Now, the insurance company could choose to opt in or opt out, but if they opted out and didn't agree to these terms from CMS, they could not get this subsidy per member. So what this caused is a lot of stabilization and not as much radical changes on the standalone prescription drug plans last open enrollment as a lot of people thought we were going to see. Fast forward to now, we're in September at the time of recording this. We're about a month away from Medicare annual election period that starts October 15th and goes through December 7th. And CMS announced that they are going to be scaling back over time this subsidy to these insurance companies. So instead of it being $15 per member, it is now being reduced to $10 per member. So it's being cut by a third going into open enrollment this year in 2025. The terms have also changed as well. So the insurance companies, instead of being capped at having to raise the premium by a maximum of $35 on a year-to-year basis, they now can increase them as much as $50 if they are choosing to opt in. You're seeing less and less insurance companies opt in because it's a less lucrative subsidy, and the ones that are opting in can still raise their premiums up to $50 in a single year increase. This is substantial, and this is something that you, as a Medicare beneficiary, need to be aware of. Now, I can tell you that there are still going to be plans available in 2026 that have lower premiums, but the amount of them available is going to be much fewer than we've ever had before. You're going to see a lot more plans that are $50 a month, $80 a month, $100 a month, over $100 a month, and fewer options that are lower, more affordable premiums. This is also important because as things stand right now, based on CMS's communication recently on this Part D standalone subsidy, they plan to cut it by another $5 next year before open enrollment. We'll see if anything changes from now until then. What this means long term for standalone prescription drug plans, it means that we can expect them as a whole, on average, to get more expensive every single year as we go with this new criteria of the insurance companies having to cap prescription drug costs at $2,000. Now, I recently made a video that explained that number, that $2,000 cap, changes a little bit each year. In fact, next year in 2026, it's already been made public information that it will be going from a $2,000 cap to a $2,100 cap. But that being said, it doesn't change a whole lot for the insurance companies, and we can expect these premiums to continue to increase and creep up as time goes. This is a very difficult thing if you're on a Medicare supplement plan, and you very well might want to take a look at the premium increase of your prescription drug plan this open season. If you need help with your Medicare health plan, like I said at the beginning, give us a call at Everything Senior Insurance. We have no cost, no obligation for our services. You can call us at 801-255-5340. Again, our office number is 801-255-5340. And one of our licensed, extremely well-trained specialists can do a free consultation with you and see if there's an opportunity for us to help you with your plan in 2026, again, at no cost. We're licensed in 46 states, so give us a call. There's no harm in doing so if you feel like you need help. Also, if you found this video helpful, insightful, educational, it taught you something coming up that you need to be aware of that you didn't know about, do us a favor and drop a like on the video so more people on Medicare who desperately need to hear this information can find it easier. We certainly would appreciate your support. Comment your thoughts down below. What do you think of CMS starting to take away this subsidy? Is it a good thing? Is it a bad thing? We'd love to have a dialogue with you about it. And make sure to subscribe for future Medicare videos. We're going to have a lot more coming out with open enrollment looming and in the horizon. And until next time, everybody, thanks for watching all the way to the end. I'm Christian Brindle, and happy Medicare, everybody.